Is your microphone on? Yeah. Let's see. Oh, we're still waiting on Bill? Yes. He's not in the, nope, he's not in there. So you can not, I say pause. All right. All right, Bill, we're ready for you to start us off.
Awesome. Well, thanks for everybody for coming. We'll go ahead and call the meeting to order, and we'll start with the roll call. I'm here.
Director Morales. Present. Thank you.
Okay. Do we have any public comments?
Nope. Gail has none, and we received nothing via email, and there are no other attendees in either Zoom or in person.
Awesome. Okay. Well, moving on, we just really have one agenda item here. It's basically working on our new updated strategic plan. So if I may, I'll just make a couple comments here, and we'll kind of talk about the process that I was thinking about working through, and then we'll go from there. So first off, I would just say I think we're in a great time to be working on this, having just finished our mission statement and the vision statement. I think that both of those will factor heavily into the strategic plan for the district and kind of the direction that we're headed in. So definitely think we're in a good position there. Real quick, as far as the committee goes, strategic planning committee, I've always had a little bit of a criticism for like just the concept of it being committee based. I think in the past, maybe the strategic planning committee has been more, I guess, short-sighted, tactical. Some of the stuff that we've worked on here that's been worked on in the past hasn't exactly aligned with what we're doing strategically. So my vision moving forward with the committee after we work through getting this 5-year plan is hopefully getting to the point where this committee is maybe a quarterly meeting that's specifically looking at where we're at on our strategic plan. Not looking at the next 6 months or the next program that we need to approve. That's more of like a board direction, board meeting type thing. And I'd really like to move this committee towards, just holding everything accountable to the strategic plan. Generally, the strategic planning is a function of the board as a whole. So, it's definitely difficult sometimes in this setting. So my thought process, I guess, number one is I want to have a little bit more of a collaborative process. So I asked Rachel to have definitely have staff here available. I plan on asking all the staff basically their input. I hope that you came ready to give some input and, kind of give your thoughts about where you see the district headed in the next 3 to 5 years, what you think that we can do as a district. And so I'm definitely interested in hearing from the staff, all the employees there. You guys have to work for the district and implement a lot of the stuff that we're working on. So realistically, I'd like to know a little bit more. So the process I kind of had that I was thinking was we'll have this meeting today. Hopefully, it'll give an opportunity for a lot of the staff to give their opinions and their thoughts about the current strategic plan. I'll leave it kind of open-ended, where you see the district headed in the next 5 years, where 3 to 5 years, and just looking for your input on that. No real pressure to say anything specific, but just hoping to get some input. I plan on hopefully, if somebody's taking notes, maybe we can get those notes out to everybody that's here after the meeting, so that we all kind of have an idea of like what everybody said. And then I would plan to report back out at the November board meeting as far as what the general talk was in this meeting. Hopefully get some board meeting or some board member discussion and input at that particular board meeting, then come back to this strategic planning committee, flesh some things out, hopefully come up with a document that we can then take to the December board meeting and, whether get more input from the board or hopefully get something finalized. And then my hopes would be that we go into 2024 with like a good vision and a good direction for where we see the district headed. So those are my thoughts. I'll open it up, Rachel, if you have any thoughts on that or concerns, and I'll leave it to you. And then Barbara, if you have anything as well.
Well, I'll jump in, Barbara, if you don't mind. I've got a couple of ideas that I agree with you, Bill, moving this per our bylaws, we only have to hold this meeting quarterly. I agree that moving this from that tactical short term will be beneficial. I think creating a 3 to 5 year plan in the next 2 months, I think will be a little tough to do. I think we have some significant questions that we need clarity on before we can outline a longer term plan. So I think that, Bill, I think you're optimistic. I'd like to see that we could do it in 2 months. I'm not 100% committed that that's going to work, but we can work toward that. I know that there are 3 main questions that I've had, and I'll toss my questions out if this is a good process. Okay. Barbara indicated she's good with that. So I think consistent with our mission and vision, we've had conversations around the types of services. We know that some form of increased support for clinical care is a long-term goal. Exactly what that looks like is still being developed, whether that's in urgent care, primary care through a partnership, or exactly what that looks like. Second is understanding that our grant process is going to probably continue to evolve. If we can have a conversation at the board level about your tolerance for change, whether it's increase, decrease those percentages, maybe move more toward MOU for consistent services and move them out of the grant cycle so that we know what's real grant dollars versus programming we're going to always bring in place, like Palomar Family, Michelle's Place. Those are 2 entities that we've moved on to the property that were more consistent services. So we'll have to look at the grants process with that. That ties in with that first part about clinical services. If we do partner with an entity, there's going to be probably a financial constraint to that. That's going to limit what our opportunities are for programming and or granting. And then from all the different committees and board members, there seems to be a lack of consensus yet on, are we expecting programs or use of the facility to be able to generate some revenue so that we're recouping fees for desired programming and or for future building maintenance? So are we expecting that we will charge for some things out at the wellness center or not? And we should probably have an in-depth conversation around maybe what that looks like. Again, those are more foundational to me. And then I would love to just see a nice ongoing dialogue about defining what the successful use of the Community Health and Wellness Center looks like. Does that look like clinical services? Does it look like how it's emerging now? Does that look more like a community center model? So those are some of the thoughts. And then from that, obviously, those answers, I think we can start to generate smaller time-limited tasks that are, what do we expect this building to look like? What do we expect this field to look like? And we've been doing it the opposite direction up till now. But now that we've got some good handle on the building, I think it's time to move to that 30,000 foot. So those were a whole bunch of my thoughts.
Awesome. Thank you for that. Yeah, no, that's good. I mean, if it takes a little bit longer for us to work it out, that's fine. You know, but I definitely want to get to a better process. You know, just real quick before I let Barbara go, but just some quick criticisms of stuff that, like, you know, does everybody have a copy of the current strategic plan there?
We do not really. The last strategic plan were all the basic tasks from last year that were identified with Taylor design, finishing, completion, and pretty much it was just 1 year projects.
Yeah. Yeah, and that's basically my biggest criticism is that I don't want this strategic plan to have you know, approved site logic by November.
Right.
Like, you know what I'm saying? I'm not looking for that. Or you know, another thing that you know, kind of doesn't look right to me is, like, I know we've talked like that transportation piece for a long time, and there was talk about potentially like lift and different things, and I think this is one of the things that's like, it just sits on the strategic plan dead. Like, it doesn't seem like there's really any work getting done. There's not a whole lot of buy-in to that. Maybe it's not feasible. And, you know, I'd really hoping for a strategic plan where there's a lot of buy-in, and everybody's kind of on the same page with it, and it's stuff that we can definitely accomplish. And it's not just kind of sitting there like year after year, like, yeah, maybe we'd like this thing to happen, but, you know, it's currently not, you know. So that's kind of just my thought. And I agree with you, Rachel, about the 30,000 foot deal. It'd be good to, you know, just, hey, like, where do we see ourselves headed? And then it can definitely give you and the employees there at the district more latitude to figure it out, and, you know, kind of do like what we trust you to do, you know, instead of just kind of sitting here and just, you know, hey, like, let's do this program and that program, and you know. So I think we're at a place where, you know, I definitely trust you running the district and the staff there. I think we got a great staff, so, you know, there's no reason for us to sit here and micromanage every little thing. Just kind of my 2 cents.
Right.
Barbara, if you want to you give your thoughts where you think we're headed, any of that process, and then we can kind of go around, and, you know, any of the staff would like to give their thoughts, and, you know, we kind of go from there.
As probably one of the oldest members sitting, I've seen the changes in this for the past 2 years. And I can honestly say, forward, and one of the biggest obstacles we've overcome. Answer the question, what does the healthcare district do? So our recognition within the community, people know that we're here, and they know we're a partner to support them in the programs that they have going for the betterment of the community. I understand the frustration that we've had with strategic planning and trying to address certain components of the wellness center, maybe the development of the transportation, etc. Number one, transportation is always going to be a need and a concern. It's just the way the community has developed. We have had this challenge ever since I moved to Fallbrook 23 years ago. All the healthcare districts have issues with transportation as well. And some of them have even created their own quiet private transportation network to help facilitate those more intensely managed patients that need transportation. But it's improving. That's a good thing. We have gone away from a hands-on licensed acute care facility that where the landlords of now to a functioning wellness center that does not do acute care services. We are in the best position to educate our community and empower them and provide them the tools to make sound decisions for healthy individual living as well as healthy family living. And I think that the programs that we have currently that we are using and are tailored to that. We're exploring the other entity of mental health, which I think is going to be a continued great need for all levels. Because I don't know if you're aware of it or not, but our governor just signed a law that is allowing 12-year-olds to disenfranchise from the parent and the home and become sort of a custodian, the state becomes a custodian of the individual. And I don't know if this is going to fly. I don't know where he's going to get the funding. I don't know how this is going to communities, and we'll have to see how it rolls out, because Sacramento's way of thinking and how the real world functions are kind of at odds with each other right now, in my opinion. But the truth is, there and taxpayer dollar to provide direction and information so that the citizens of the community can feel that they have a resource to be directed to what other further care they may need, because it's all about becoming an own manager. The healthcare system at this point in time, I think, is upside down. There's a lot of challenges we're facing since we went through the COVID thing, as far as information that we're getting in accurate format and current format. You don't know where the data comes from and if it is authentic. So there's a challenge there. I can also say what we've been providing the community from our centers has been current and timely. If we don't know, we'll tell you. If we don't know, if you're primary care. So we have to remember that we are not in the business of providing the services, but that we are there to promote wellness and education to our community members so that they can make healthy choices and healthy decisions. With that, I would love to see partnerships develop with the center, as Rachel has been investigating with different entities to move forward. And of course, because it's a government entity, this is taking a longer process. Dealing with healthcare usually involves where's the money coming from, who's going to pay for it, how can we get these services provided. So unless we're going to move it becoming a healthcare delivery system for specific services, we have to remember that we're just kind of the advocate for healthcare for the community and its members to help them answer questions, get information. I think we can fill the gap by providing the center with more programs, whether they be CDs or videotapes or lectures with regard to the specifics regarding the healthcare of an individual, from pediatric to gerontology. For them to have a resource to go and ask questions, where can I get the answers to? What do I do if I have this? What do I do if I'm faced with autism? What happens if a family member that has Alzheimer's or dementia or whatever? How do we have the coping skills to deal with all of this negativity that we're getting from the news and the world situation? How can we stay grounded and focused and calm to continue to move forward and be productive and not be so anxiety ridden? I think that that's a comforting thought to know that the wellness center is there with its yoga programs, and the other programs that are there to help people. So I think those things are really important. I'd love to see them continue to develop. And as far as the typical upgrades of the facility, I know that we're moving in that arena, and we've made tremendous success, made tremendous progress from when we first got that building. And it is a long-term process. It just is. As you uncover one thing, it shows another area that needs to be addressed. It's like, having a fixer-upper, and I'm going to get that person in house. But we're doing fabulously. And the community, I think, is receiving us well. And the positive reaction that we're getting with the staff and the community, the feedback from the internet, and when we have some type of event, I think has been really good. It just needs to be really good communication resources that you can make yourself, you can build yourself up to help to solve your problem. So I see us growing. I believe that there's an opportunity. Again, we talked in the past about kind of being an umbrella for Foundation for Senior Care and what they're doing and maybe mirroring some of their programs. But the idea is that the community is now really more aware of health-related issues, especially post-COVID. Everybody's like, okay, what do we do now? So this is excellent timing to consider wellness, positive mindset, coping skills, and information to help solve the problems. And again, referring them back consistently to their primary care provider, because that's where they need to get. We can be a resource to those medical groups in the area and those health plans. So I think we're on the right path. The process again is it's longstanding. It's painful at times. But I can tell you that we have had more successes than failures over the years. We're moving into the future and the development of a totally different kind of healthcare delivery system. And I think we're preparing for it. And it's more of the patient becomes their case manager. They become more aware of what's going on with them, and then they give the comments back to their doctors and I think finances, so far so good. We have been fortunate. I don't know what the future is going to bring, and it would be beneficial to have different programs where we might have some revenue generating events, but we have to think about the ramifications of that. You don't want to say it's a club and you have to pay this to get involved with our programs. That's not what it's there for. But if there's a possibility to lease out some of the space for events or whatever, I think that's a good idea. So those are going to be continuing ongoing conversations, and more that we interact with our community programs, our Chamber of Commerce, and the Rotary, the Lions Club, the other entities here in Fallbrook that may need to have a little more PR or maybe have some space to hold an event. That's great. Education system, more interaction with the high schools, the middle schools, with regard to teen health and awareness, especially during this fentanyl crisis and the drugs and these designer drugs and the weird things that are going on. The more information that we have available for them, the better, because oftentimes the problem is not being discussed at home. The kids need a resource, and maybe we can be that resource, and knowing that we have the availability for mental health providers, and we also have a connection with the clinic down there.
Yeah, Fallbrook Family Health Center.
Health Center. Our teams have the availability to go to a professional and have their needs addressed and confidential. So that is a good thing. And we need to encourage our teams to stay alert, stay engaged, and be alert. Only you know what's best for you. And if that tells you now, then listen to your gut. And we're moving, we're making great progress in that. We used to have a very active program with the school, but the dynamics have changed over the years, and we have to be careful. But we can't let those teams not think that they're not part of the community and they have a future here. And with the Boys and Girls Club, the more you're involved, the more that we put out there for them to let them know that they are important in the community, and what they do affects all of us, and what we can do to help them makes a stronger community. The grant process, God love us, and God bless those people that are doing what they're doing with the monies that they receive from the grant funding. I know that as we're changing and growing, we may need to have more financial direction toward the Wellness Center. But I do believe that the grant process, as all grant processes, have a definite purpose. It is initial startup. It's to help them to get on their feet. But we cannot be in a position to be primary source of funding for an entity, and I think everyone is aware of that. It's not our money, it's taxpayers' dollars. And we're held accountable for proper dispensation of the dollars for the community. Excuse me. Anyway, moving along, I'm happy that we're taking a look at this. I agree that we need to have more input and to open it up for another person's perspective, because you can't just have 2 or 3 people who've been sitting there looking at the old strategic plan and go, well, that was good enough. Why can't we just do it that way? Well, we're changing. The needs are changing. And so our vision may have to change as we evolve to meet the needs. So it's ongoing. Our wellness center has taken on a life of its own. Our strategic plan needs to be able to facilitate that, as well as continuing with our grant process. And I think we're doing well. Of course, there's always room for improvement, but I think that we have a wonderful staff and board that if we put a workshop together and specifically address any particular item, we will have a positive outcome. So that's my contribution. I say thank you to all of you for what you're doing from where I came in with one other person and to board members that have been there like forever. The changes that we have experienced and the positive impact on the community and the transition from going to a hospital-based healthcare district to a non-hospital-based, more community-oriented, more like a rural approach to medicine. It's been remarkable. And partnerships that we've had with County Fire, Alomar, all our grant recipients, I just think it's a wonderful thing, and I hope we continue to grow and move forward. How's that go?
Sounds pretty good. Thank you. I appreciate that. Good stuff. Yeah, no, I agree. I think we education, educating the community in some ways, it definitely plays a big role in kind of getting us to where we want to get. Just real quick, there's just a couple things that really kind of stood out to me from just the mission and the vision statement. Just a couple areas. It said highly skilled staff. So that's important to me. I think it's important that we hold that in, and I would say like highly trained and educated board members. The more that we do as far as that, the better. The California recognized special district, I think that's a big component of it. Getting us to that point and furthering that, and just the part where we talk about giving the residents an opportunity to have a greater lifespan. I think that there's ways that we can certainly impact that, and that we can look at that in our strategic plan. I think that the diabetes prevention program definitely lead to greater lifespans. So I think that that's a program and a goal that definitely kind of aligns with that. But yeah, let's unpack, and I hope to get a lot of impact, a lot of perspectives. Rachel, maybe we can ask Jeff to get maybe if he can put something together saying exactly what are the parameters of as far as grant versus MOU. What's the exact legal requirements for us as far as what we would need to switch which programs, and maybe which programs would qualify. I think that could definitely smooth out some of that process. So, I mean, I'm sure that we'll have some administrative type goals or whatever, like as far as stuff like that goes. And I'd definitely be open to exploring that. Rachel, I don't know if you have any response or anything to add to Barbara's or anything, or if it's okay with you, maybe just open it up to the staff. If anybody would like to.
Yeah, I would say we we have Teresa and Judith and Raquel here this evening. I
Awesome.
know we just did a staff meeting last week where we talked just generally about the staff being able to meet annually to do our internal, if you will, strategic planning and goal setting so that we could better align and to follow along with the board's strategic plan, knowing that we were going to have this shift in our conversation. So I would turn it to them for any concept conversation at this point.
Awesome. Thank you.
Rolling. The development of the a better opportunity for those funds. So I think kind of working on is the development of that community. So to me, that's a foundational piece for our finances, but it all to me, opportunities for partnership. It's hard to figure out how our teams go and learn how to and I agree a lot with somewhat from childhood, but for me, with other organizations in the community, just knowing what on track and lifestyle, diseases of heart health and diabetes, these type of things, other goals there. I think like a true goal of what or conditions there help a lot as we would big what is the goal? Really help a lot and help finalize our messaging. Like a brochure, these simple pieces with that clear direction. What I'm looking for is I'm looking for programming to look where to go what to look for. To look for, like, right now, we have a lot of educators that are really involved. You know, are we gonna have, do you want to have, do you want to program, like you were saying, highly trained and, you know, other people in that regard, and I'm gonna want to invest a little bit more. Right, that all comes to the bigger, like, where is the top? Like, what is successful? What's the gap between so is it that we have this much engagement? You know, what are we looking for as success? Well, Raquel here. One of the things.
Thank you. Yeah.
One of the things that really, health insurance was about the community, health and wellness centers. And really, it was really something that I knew the community, and it's something that is here. We need to work on it, improve it, make it the best. I even had just a couple. If you build it, they will come. And they came. So focusing on the community aspect from 0 to 100, from birth to 100. That's where I see the future. I really feel that that's where 5 years, 10 years. So that in itself is going to be. And of course the grants. Looking at it, now that I'm working on the grants, MOU is really important.
Yeah.
Really important. And I hope we can. Yeah, it's a lot.
So back to you, Bill.
Sorry, I was muted there. Right on. Well, I really appreciate hearing that. I'll have to kind of go back through the maybe if you guys could send me the video when you get it done, the recording, I'd appreciate that. But I heard I think 90% of what you guys were saying there. So definitely appreciate the input. You know, like I said, I think from here, I don't have a ton of grand thoughts about the strategic plan right now. I think that at this point, just looking for different perspectives and some ideas out there. I'd like to, we'll maybe put on the agenda for the next board meeting a discussion item where we can report out on some of this discussion, and we can get like some preliminary ideas from the board members. Maybe if each of them can provide maybe a couple strategic objectives that they'd like to achieve or that they'd like to see the district get to, with the caveat that we're looking for like 3 to 5 year kind of ideas. And we could have a little bit of a discussion at the board meeting, and then I would also leave it to your discretion, Rachel, if you think that there's any other of the staff that aren't here today that would like to give their opinions or give some input. I would be open to, either them coming at the board meeting, or if they prefer to just write something up or whatever, I'd leave it up to you, whatever you think. But I'd certainly be open for more input for other employees that weren't here. We can kind of get their thoughts in there, and then have a little bit of a discussion. I don't plan on taking an hour or anything at the board meeting, but maybe we could take 20 minutes or so, 25 minutes, and get a little bit of a quick discussion, and it can kind of drive our next committee meeting, and hopefully we can kind of start chipping away and kind of getting there. But that's really it for me, unless anybody else has anything.
Yes, Bill, I'd like to make the recommendation for the possibility of having a presentation of the board members' perception of the last seminars that they went to with regard to how special districts are looking at this in their specific regions, and how they are dealing with the changes and where they see themselves in the next couple of years. Because we are not alone as a district without a hospital. And I'd like to hear what they have done to help position themselves to deal with these changes and be more proactive in the community. The other thing is I would love to be able to find a source that is reliable on cutting edge technology, whether it be a university hospital or colleges or whatever, to find out this question statement that has been floated around about NBES, which is sort of like a scanning kind of procedure that is actually being programmed to the individual to help promote healing. In reality, is that something that's going to come out? I understand supposedly the military has it, but how do we put ourselves in position to possibly facilitate something like that if it does indeed come around? It's just a thought.
Awesome. Yeah, no, I appreciate that. I definitely think we should keep that in mind. One other thought, I guess, before we close, Rachel, maybe if you can, I know that they have that CSDA strategic planning on-demand webinar. Maybe if we can kind of push that out to the rest of the board, you know, so that everybody's kind of on the same page. There's definitely some good, I thought it was pretty informative from my perspective. It's about an hour long, and it definitely goes over some of the elements of strategic planning and kind of formulating a plan. And it even kind of, like, it was helpful for me when I watched it kind of working through the mission statement. So it kind of talks a little bit about, you know, taking the mission statement and kind of putting that into action with the strategic plan, and then kind of followed by a work plan at the employee level. So there's definitely some different perspectives of different districts that do it different ways, and some good examples there. Maybe we can send that out and just, you know, request to take a look, and just with the thought in mind that we're definitely working towards a new strategic plan, and the more educated the board is on the process, the better.
Sure. Yeah, it's easy for us to forward the specific link to that training to everyone, and it probably wouldn't hurt for the staff to take a look at that as well, so that we're all on the same page for that conversation.
Absolutely. No, I definitely agree with that. Like, that would be great. And you know, it definitely goes towards, you know, having highly skilled staff on hand. So definitely in favor of that. And then I guess we'll just kind of continue that discussion. I'll report out our discussion at the board meeting. And then, like I said, if somebody can forward me the recording of this, I'll kind of go over it again, and any notes that you have on the meeting, and then I'll report on that, and then we'll kind of go from there. But definitely open to more input, and, you know, any of your thoughts moving forward.
Good. Well, and we'll upload this to the YouTube channel. So once we have that on there, we'll let you know it's where it's at.
Awesome.
And then I'll just follow up with the team, and we'll talk here to find out what staff members either can come to the next board meeting, or at least get their feedback, so that we can report with that. We'll also then push forward to the board members that CSDA strategic planning webinar. And you're talking the specific one from the last CSDA conference, right?
No, I don't know if there was one at the last conference, but if you go to the on-demand
Okay.
webinar,
Yeah.
it's called like, build a better strategic plan or something to that effect. And it's about an hour long. It's run by some consultant guy. But I thought it was pretty good.
Okay, I wanted to make sure that I was gonna put forward the right one. And I think we have it from your stipend report, which one you took, so we can cross-reference to that. Yeah, no,
Yeah, no,
that'll help us
I've definitely
cross-reference.
taken a lot of it.
I
for
know.
sure.
But that'll help us cross-reference to make sure that we're all talking from the same training webinar.
For sure. Yeah, that'd be great.
Yeah.
Alrighty, well, if we don't have any other comments, we can go ahead and adjourn the meeting.
Okay, sounds good. Thank you, Bill.
Awesome. Thanks a lot. I appreciate it. I'll see you guys next week.
Sounds good. Thanks.
All right. See you then. All right.
Bye.